You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.
Welcome back to the podcast. This is the third and final installment of the mini-series on PTSD talking therapies. This episode is going to be focused on cognitive behavioral therapy with Seth Gillihan. So Seth really dissects what CBT is, the use cases. He also unpacks his approach to CBT, but really gives a nice anatomy of exactly what CBT is, what purpose it serves in being a fundamental part of the talking therapies, a part which is both empirically proven but works for a lot of people. So please do enjoy this episode. It's just relevant to say that this episode was screened a while back on the Restore podcast, so you are going to get some special effects, some sound effects in the episode. Just do ignore those. This interview really does serve the purpose for unpacking exactly what cognitive behavioral therapy is in the therapy room, and Seth gives a really unique view. I'm going to also put some links in the show notes to Seth's work. He is a fantastic therapist, but he's also a world-renowned therapist. He's been featured on the Sam Harris podcast a number of times, and a number of award-winning authors. So do please enjoy this episode. He has got a range of books out himself, one of which we unpack in the episode, but fundamentally just really want to unpack what CBT is. Please do enjoy. In this session, I have Seth Gillihan with me. Seth is a practitioner of CBT, psychologist and professor, and has written a number of books on the utility and usefulness of CBT. He's also written a book, the CBT Deck for Anxiety, Rumination and Worry. And what we're going to do today is really just dig into Seth's background, into the book itself, and into some of the tools that CBT offers from a cognitive therapy perspective. So Seth, welcome to the podcast.
Thank you, Owen. Thanks for having me.
Could you just provide listeners a little bit of background on yourself, if that's all right, Seth?
For sure, yes. So I completed my training in clinical psychology. I've been a licensed psychologist for, I guess about 11 years now. And for the first, I guess 4.5 years after I left academia, after I left my graduate program, after I graduated, I was leaning toward going into research initially. That's why I did the PhD. But then I felt somewhat disillusioned with research, so I planned to go the clinical route because I wanted to make a direct difference in people's lives. But then at the last minute, I thought, maybe if I do the right kind of research, maybe that will really have the kind of impact that I want to have. So I spent those next 4.5 years at the University of Pennsylvania doing research in trauma and post-traumatic stress disorder treatment. It was very meaningful work, but what stood out most for me was the direct difference that I was able to make in the lives of people who are recovering from, the worst moments of their lives, horrifying traumas that just, unimaginable things. And so I left that position. I did some teaching, but really I was transitioning to doing full-time clinical work. And so over the last few years, I've had a full-time clinical practice, but I've shifted more toward, wanting to bring these effective treatments to as many people as possible. So that, started with doing with writing a book, and then starting to blog, and then writing additional books. And then what I'm really after is getting these practices into our moment-to-moment lives, because it's easy to read a book, and then, I've read so many books, and yeah, that was a nice book, seems important, and then just kind of move on to the next one, and there's not much uptake. So trying to get the practices into more and more digestible pieces. So that led to these card decks where you take a card, it's a simple practice each day. That's been a really kind of fun thing to do. I actually often will use the practices myself because I need them as much as anyone. And then in the past year, I've been doing a lot of writing for a mental health app called Bloom. It's the self-therapy app. So that's been really rewarding working with a great team. And because that's, I mean, we'll probably talk some more about technology, but so I had mixed feelings about bringing it into a digital format, and encouraging people to be on their phones more. But the nice thing is it's using the technology in a way that actually serves us instead of disconnects us. And it's not designed to be appetitive, where it's like, I want more. Ooh, that's good. I want more. I want more. I'm going to spend 5 hours on this app today. It's really more about checking in for a few minutes each day and then using the lesson from that day then in our real life. So that's the past 15 years or so in a few minutes.
That's fantastic, Seth. And just picking a few of your answers there, actually. So talking about sort of the democratization, and we've seen that proliferate over the last few years with apps actually into the digital space. But just before we started this conversation, we were talking offline around the dichotomy of FaceTime or screen time versus being present in the moment, and actually what that does for your mental health, and the utility also of community.
Yes, so much of our lives now is two-dimensional, right? Like, I mean, and arguably it's that third dimension that really makes the difference. It's the difference. I mean, you can't hug someone in 2 dimensions. That's kind of a big deal. So yeah, there is something about, and this may be a theme we'll return to, but we're often drawn to exactly the things that are not giving us the best experience, that aren't really enriching our lives. But we come back to them over and over and over. Maybe that's the trick of social media, is they give us enough to keep us coming back, but not enough to satisfy. So we want more and more and more.
If we're looking at some of the fundamental issues around anxiety and worry, because I'm mindful that the book, the CBT deck for anxiety, rumination, and worry, really is around directly addressing anxiety and worry. So how does CBT help tackle some of these fundamental issues around anxiety and worry?
Well, I think in three big ways. So, and it's captured in the, I call my approach mindfulness-centered cognitive behavioral therapy. So the mindfulness part is, I mean, the shorthand, I like to keep it simple, is just think, act, be. So the think is the cognitive part, be is behavioral, and be is mindfulness. And so the first part is addressing our thoughts, because our thoughts often project out into the future, and we assume like, oh, this is going to go badly, or I'm going to mess up, or people are going to think I look stupid or something. And so we can question those thoughts. And we used to spend a lot of time in CBT really kind of wrestling with our thoughts. Like, okay, you want to write that down, and then how much do you believe that, and what's an alternative, and what's the evidence for it and against, and really kind of rolling up our sleeves and getting in there. But I think most of us are finding that most of the benefit comes just from recognizing, like, oh, that's a thought. That's a mental event that my mind made up. It might be true. It might not be true. And maybe there's an alternative. So I think, I'm going to have this conversation today. Let's say this one, I'm going to speak with Owen, someone whose name I didn't know how to pronounce, and now I do. Right. So I didn't know you. I don't know what you're going to be like. You're lovely in our email exchanges, but who knows? So I could have had all kinds of predictions about, oh, like this is going to be like I'm going to say stupid things, which might still happen, or it's going to be an awkward conversation. But all those would have been just fantasies. And I can recognize, like, oh, wait a second, maybe it'll be quite a nice conversation, and maybe I'll learn how to say his name. It'll be quite easy. I did imagine, like, oh, what if it's kind of complicated, and I kind of get it, but not quite. Right? That's the story. It's the story my mind made up, and that turned out not to be true. So that's where we start. I can talk about the behavioral and the mindfulness parts too, but I can pause there if you have any thoughts or questions.
So that's fantastic. Absolutely. And I think it's about addressing the underlying narrative that the brain makes up prior to an event. Because, you're right, quite right. Unpacking the cognitive behavioral aspect, fundamentally it starts in the brain and then affects our behavior from images or narratives that the brain makes up, and then you play out behaviorally, and so addressing those before they even become behaviors or steadfast cognitive highways whereby we always go down that path.
There's this idea about a little path that a deer walks, and then it walks it again because it's trampled a little way through the woods, and then later on maybe the natives to that area turn that into a footpath, eventually becomes a highway. These things get worn down and as you said, like concretized over time, and then we can recognize like, oh wow, I've got this whole like I'm a loser super highway, right? I've got the autobahn of self-doubt, but I can maybe take a different route. And I might extend that metaphor and say that we always have that option. We don't tear up the road and get rid of it, which I think we would like to do. Say, all right, that's done. No more self-doubt. I'm done with self-doubt. But it becomes we have an alternate route. But sometimes we get detoured, and then we're heading back that way. We're like, wait a second. Oh no, I'm back on this one, right? So we look for the first exit and we get off. And maybe CBT is about finding those alternate routes, and also about finding a quicker exit, so we're not spending so many hours going down that bad highway.
In your answer before, Seth, you mentioned the utility of the book itself. It gives you this deck of daily practices, which I think is really applicable to day-to-day life, because you can just use snippets of the information in your day-to-day practice. So I was going to ask you sort of some of the main themes of CBT that you've used in a practical way for readers.
Yeah, one of the best things I learned from my first supervisor in cognitive behavioral therapy, Rob DeRubis, was for each session with a patient, try to leave them with just one thing to take. Because our tendency is, okay, I want to give them so much. I want them to have all these options, but it's overwhelming. But if we just have one key thing, so that's what the deck is about, is extracting. Okay, there are endless ways to apply. Let's say behavior therapy, the second part, the ACT part of Think Act Be. If I have 5 options, it's a lot like having 0 options, because I'm going to struggle to keep them in mind, and I'm going to think like, well, should I do this one or should I do that one, or I don't know, maybe I'll just skip them because it's overwhelming. But if I have a card for that day and it says, when you're feeling stuck in an unhelpful train of thought, stand up, change the scenery, move to a different room, get your body moving, which can get your brain unstuck. Then that's like, all right, that's one thing I can practice that day. And if I do that over a number of days with different practices, different cards, then I'm building up a kind of library that I can draw on.
Could you speak to the sort of functional analysis of behavior problems? What does that mean, and how does that play out in day-to-day life?
Yeah, maybe it's best illustrated with an example. So this often comes up where, let's say, we're feeling a little sort of that sense of ennui, like I don't have a lot of energy. I'm not really depressed, but I'm not very motivated to do much. And then maybe a friend says, "Hey, you want to come out with us tonight?" And we think like, do I want to go out? And if we don't, then we get an immediate reward, which is we get to relax. We don't have to get all dressed up. Maybe we're a little anxious about going out. Maybe we have a little social anxiety, like most of us do. We avoid that. Whew. So the brain interprets that as an immediate reward. That's in the short term. But if we look again, that's part of the function. The longer term function of that avoidance behavior is actually a punishing outcome, because we miss out on the social connection. We see ourselves as someone who turns down opportunities like this. We don't get the fresh air that we would get from stepping outside. So we want to understand what the kind of payoffs and costs are for our behavior. That's a big part of the behavioral approach, because when we do, we can step out of those immediate short-term rewards that tend to be, it's almost always the the path of least resistance is usually not the one that's going to be most rewarding for us in the long run. So that's going to be things like escaping with drugs or alcohol, um, staying home and avoiding people. Um, Pretty much, I was working with someone one time who, we had a number of these types of things where he finally said, it seems like the general rule is the right thing to do is the hard thing. I was like, I mean, that's kind of true to some extent. I mean, it's harder in the short term often, but in terms of long-term pain, it's much easier to build the kind of life you want if you're thinking about those longer term payoffs. So I think of a functional analysis as just understanding what are the inputs to our behavior, like the types of antecedents that like being invited out when we're tired. That's the kind of situation we can think about. How do I tend to respond? Then there are different behaviors that we can do, and then there are consequences to those behaviors. When we understand those different parts, then we can choose more deliberately.
So, Seth, how does the book seek to address the sort of the cognitive monitoring and restructuring that occurs within our habitual practices?
Well, so much of it is just about increasing awareness. So noticing, there are lots of cards about, just notice the stories you're telling yourself, question them in different ways. If you expect things to go badly, what if you ask yourself instead, what if today goes much better than I'm expecting? Because that could happen. So starting with awareness, and then, because we often just think we're observing reality, right? We think like, oh gosh, um, I am being really boring right now. People hate what I have to say. Like we have those thoughts, but we think that that's just an observation, like the sky is blue. But when we recognize, like, oh, that's just some story that my mind made up, then again we have that choice. So it's all about repetition. That's why there are many cards about it. Because I teach this stuff. I've written about it. I work on it with my patients, but again, I mean, every day I fall into these, believing these stories and have to question my own thinking.
That's fantastic. So, looking at emotional instability, Seth, how can CBT help with offset or indeed transcend some of these emotional instabilities that occur in us?
Having just a little bit of distance from our emotions. So that's, I think, where the mindfulness part, the B part of Think Act B, I think is quite applicable, is in allowing ourselves to observe our experience and to realize that we're not completely identified or defined by our emotions or anything, our thoughts, even our actions. But it's easy to kind of become our emotions. Like, I am angry, I am sad, I am depressed, versus, I'm experiencing those things. I remember it wasn't that long ago, I was having such a rough go of it one day, and I was lying in bed, feeling totally defeated, crying, and then I had this sense of myself, kind of like I was seeing myself there in the bed, and kind of had this feeling of compassion for myself. Like, of course, like, you're having a rough time, aren't you? And the time I was like, yes, I am. It's been a hard day. But there was something comforting in being able to take that perspective because there's that observer part of ourselves. Like, if we know that we're having thoughts and we can observe our thoughts, there must be a part of us that is not the same as our thoughts. The same with our emotions, the same with our bodies. So that part of ourselves, which I like to think of as just, it's kind of pure consciousness. I call it the you-iest part of you, kind of the deepest part of who you are. We can just start to identify with that part of ourselves at times. Then it doesn't erase our experience at all. It can actually help us draw closer to it, but in a way, as you were suggesting, while transcending it. And then based on that awareness and acceptance, what am I going to do about it? So acceptance, of course, as you know, doesn't mean resignation. Like, okay, I'm sad. I'm just going to be sad today. That's just how I'm going to be sad forever. but receiving that as my reality, and then based on that, deciding what to do.
So just looking at some of the common cognitive pitfalls, Seth, that people sort of fall into on a day-to-day or week-to-week or month-to-month basis. How does CBT? We've actually touched on a lot of these, but
Yeah.
what I suppose actually a helpful question might be: what are the common pitfalls you've seen in practice and heuristics and biased thinking that you see people fall into?
Yeah. Yes. Yeah, there are lots of them. I'll just hit some of my favorites. Uh, Probably the ones I tend to do a lot. So we call these, I mean, formally they're called cognitive distortions. I like to call them thinking errors. I think it's a little maybe more intuitive, but I like what you said, pitfalls. So a great one is mind reading, thinking that like, oh, this person thinks this about me. Maybe they do, maybe not. I was giving a talk one time. It was basically rehearsal for a teaching job, and 2/3 of the way through, I thought like they hate this. They're so I was misreading their body language, and they didn't. They gave me the job, but I was convinced, completely convinced. Like, oh, like they feel bad for me. Like, look at that person. Look how sad they are for me and how bad I'm doing. So that's mind reading, catastrophizing. So something little, like a little problem happens, and you think like, oh my God, this is terrible. It's awful. This is the worst thing ever. Like we call someone the wrong name, and we're like, oh my God, oh, they're never going to forgive me. And it's not nothing, but it's not the mountain that we make it. Um, Shoulding is a good one. So that person, should treat me better, or I should be more patient. Those are really personal preferences, the things we would like. And if we accept them as preferences, we'll make ourselves a lot less crazy, I think, because we don't have that kind of control.
That's fantastic. Yeah. So there's a couple of others that I really fall into. One that I do a lot is sort of magnification of you call it catastrophizing, but I either magnify or minimize.
Yes, yeah, that's something I often encourage people to do. Is even at the end of the day, write down 3 things that went well, and write down what your role was in helping them to go well. Right, it wasn't an accident. You probably did something that contributed to it. And yeah, because we do tend to minimize those things, don't we? To say like, yeah, but it was luck, or it was this person. And it's nice to be generous in those ways, but it's not so generous to us when we ignore our own efforts.
Just as a side note and a slight pivot on that question, Seth, how do you get into people's mindsets around their self-talk? Because a lot of people's self-talk is negative, and fundamentally, as children, we talk to ourselves, but actually as adults, we sort of change that, and we start to listen to ourselves more so than talk. And so we listen to a very negative, biased view of ourselves, and can be our harshest critics. How do you gain access into that? Is it quite easy to gain access into someone's self-talk?
Sometimes it is. Sometimes it shows up even, in the first phone call. Someone's saying like, oh, like you can tell they feel so bad for, if they're like taking a minute to find their calendar or something, and or they show up for the first appointment, a minute late, and they're like, I'm sorry, I know it's, I value your time and it's very inconsiderate. I'm like, it's really not a big deal. Other times you really have to dig, but what we're always looking for is a specific activating event, because a lot of our thoughts will kind of lie dormant, or we can kind of dress them up, when we have time to think about it. But then in a hot moment, they come out right away. So we don't usually ask people like, how do you how do you how do you tend to respond when you fail? We'll say like, all right, what's a recent time when you were disappointed? Hope ideally like something that happened in the past day or so. So those thoughts are fresh, because we want to have as close as we can get to an actual readout on what happens, and not kind of their theories.
So Seth, looking at the restoration of equilibrium, how do you get clients and or readers, if they're reading the book and or the deck, to return to this place of equilibrium?
Mm. Yeah. Yeah. Equilibrium is a nice word because because it, for me, it invokes a feeling of being centered. When I think of like a top that's spinning at equilibrium. It's staying within, it's not spinning off or flying off the table. And so I I often encourage people to find leverage points. Like when can you do a brief practice that will give you the most benefit? So I think first thing in the morning is a big leverage point. I think we can start our day from a place of equilibrium versus, sort of spinning off balance out of bed. We're already kind of off kilter even before we've used the bathroom. So when someone's lying in bed, maybe just taking 3 conscious breaths and feeling their body. And the our worries are often are kind of waiting for us before we even open our eyes. But we can ask ourselves, when we notice that, well, what if I focus instead today on who do I want to be? Like what quality of presence do I want to bring to my relationships, or what's really important for me to bring to work today, or how can I show myself care today? But also, I have realized in the past couple of years how much I've struggled really to notice what's happening with my body, and how often I would start to realize, like, wow, like I'm holding my shoulders up. Like, what is going on? What am I bracing myself for? I'm grating carrots in the kitchen, and I'm, my one shoulder's all cocked, and like I'm tense, and I'm like, why? Like, just relax, buddy. Like, you're just grating carrots. That's all that's happening here. But it's been maybe more acute because I found out in the past year or so. I mean, I suspected this because of my symptoms, but I was diagnosed with some vagal neuropathy. So my vagus nerve is somehow impaired, and so I think a lot of that, I think it's like 80% of the highway is from the body to the brain through the vagus. I mean, and 20% is in the other direction for the vagus nerve, and which would explain a lot of why I'm kind of stuff is building up, and I'm not realizing it until I'm like my body is kind of, a tremble with stress and tension. I mean, the breath does seem, it's so simple. I mean, almost ridiculously simple, and yet it's one of these things you can explore it forever, and you'll never reach the bottom. It just keeps going. There is so much, just a simple single breath. All right, I'm back.
As we're coming into land, I'd love just to get from you, if possible, just maybe 1 or 2 case studies where you've really seen this in practice. You've seen CBT work in practice, just from any examples within clinical practice.
Hmm. I'll start with one that actually was triggered by your describing being an EMT. Um, I know I have permission to share this example because it's from my own life. But I came home, gosh, maybe I guess 3.5 years ago, and discovered my neighbor lying in his garden, unresponsive, and called 911. Was guided through, delivering chest compressions until the ambulance arrived. And I remember thinking in that moment, like, because I could feel that I was not there, that I was physically present, but my mind was just elsewhere. I thought, this is gonna this is gonna take some processing to move through this. And so, I mean, it was here. The reason why I brought up this example is because the things that helped me to process that were the types of things that we encourage people to do through CBT. But it wasn't. But I don't think of. But I think of CBT as a tool. It points us toward what we need. And so, what we need to recover from a trauma is, uh, an opportunity to feel safe again, and especially we need human connection. So when we're treating someone with trauma, who's been through horrible stress, so much of what's important is that human connection. And that was what was really healing for me. I remember I mean, my talking with my wife afterwards was extremely helpful, but I was still in that kind of like a shock phase. He ended up he was dead. He was had probably, they said, died instantaneously. But it was the next day, speaking with a dear friend of mine, also coincidentally, I guess you're not actually in England, but he was also from the UK and in England, and um, and just finding that support, and finally speaking with him, I for the since it had happened for the first time, I cried and felt that parasympathetic release, all that had been holding on to, and um, these beliefs I was having, these judgments about like how I shouldn't have felt kind of repulsed by his physical appearance, by how he looked, because he'd been dead for a few minutes. Um, and my friend who's also a psychologist asking, like, how do you think you should have responded? And realizing, like, maybe it's okay that I had that feeling, and it all released in that moment. So that's a personal example. Um, but an example for someone who's not me that comes to mind um, is a woman who is dealing with a lot of anxiety and um, anxious thoughts, constant worries. And as we dived into them and explored them, and especially as we practice some just mindful awareness of what we're feeling, and awareness of thoughts, what really started to emerge was a great sadness. That there was a real sadness there that had been pushed away, because it's often more comfortable to feel other emotions besides sadness. We go to anger, sometimes we go to fear, um, and And so when she allowed herself to start to feel that sadness, then the anxiety started to dissolve, because it was, uh, in large part, just kind of a morphed expression of that sadness that she denied. So there's just a couple of quick examples. But I have to say, one thing I hadn't anticipated in writing books was getting feedback from strangers, and that's often some of the most rewarding things, to hear someone, because you see, you get information about your sales, and it's all just numbers, but then when you hear from an individual, it's like, oh man, that definitely does a lot to keep us going, knowing that it's actually like, oh, that's someone's life, and that they're saying they're doing better now because of this work that they've done. So yeah.
What I will say, Seth, is just as we come into land on the conversation, and if there's sort of doctors, paramedics, or nurses listening to this, is there any commonality when you see clients that people could articulate whether there might be utility to CBT? Is there any commonality physically, emotionally, or behaviorally that you could maybe suggest as people listen to this and think, actually, there is a pattern building up in my life, or there is something I might need to address? Is there any warning signs that you advocate?
For people to be on the lookout for, that there may be something to attend to. Yeah, I mean, I think that a constant feeling of tension in the body, of not being able to relax. I think so many of us live in that state for so long that we don't really realize it. That our sympathetic nervous system is kind of buzzing at a low frequency most of the time. Um, that's a warning sign. And then some things that are kind of more obvious, like when we start having spikes in our outbursts of anger, or um, periods of anxiety or sadness that are just kind of beyond what we're used to, and we're not sure what to do with them. Um, I think one barometer that's probably pretty reliable is our relationships, because I think almost everyone who has come to me for treatment, in some way, the relationships were a factor. Either a loved one said, like, hey, you got to do something about this. We just can't have you keep on like this. Or they'd lost a relationship, and that had really precipitated kind of a downward spiral. Or they're just noticing that that it's hard to connect with people in the same way because of the things they're going through. So I think if you want to pay attention to one thing, pay attention to your body, and if you want to open to something else, notice what's happening in your relationships.
Seth, that's fantastic, and a great place to finish. So I'd just like to say, if people wanted to find you or find your work, where would be the best place to find it, Seth?
Probably the most central place to go is just my website, sethgillahan.com. You can find links to my podcast there, the Think Act Be podcast. My links to my books are there, and to my blogs as well. I blog there and also on Psychology Today and WebMD as well.
Listen, that's fantastic. And it's just left for me to say a massive thank you, Seth, because I really appreciate both your insights and your perspectives. So thank you so much.
It's been a pleasure speaking with you.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.